All right, this is based on clinical practice, not double-blind placebo bullshit that is all loaded with, you just can't believe, you can't trust the data. There have been articles written by people who retired from major, like one from Lancet and a couple others, the New England Journal of Medicine. They retired and they said they lament the fact that they can't trust the data that's coming out because it's all loaded. So if these people can't trust it, who are we?
So what's the solution?
Well, there's hopefully Robert Kennedy Jr. get in there and kick ass. I pray that he does, because the whole system needs a revolution. It's just profit-based. People are just, widgets, and keep you alive long enough to use 8, 10. I'm 80 years old. I'm not on any of that shit. I don't take any drug. I take a few vitamins every day, and I take some herbs predicated on how I feel. I have a doctorate in Chinese medicine, herbs, and acupuncture. So, and it's a real doctorate. It's not, I studied in 5 branches, Oriental medicine in San Jose, and I also studied at Beijing Medical University in Hangzhou, China. Yeah, that's when the lights went on, because I think they're more free to think over there. Here, if a doctor steps out of the box, he could risk his license and all kinds of bullshit. They don't like people stepping out of the box. They don't like people taking a close look at what the hell's going on. And they come down on us. I follow this stuff. I read precocious amounts of research. Most of it is all cockamamie.
So I heard that you also have great results for people who had severe issues seeing.
Okay, so, yeah.
What are you doing? And
okay, so here's,
what's the principle behind the theory?
Well, let's go back, okay? You got 10 layers of the eye, the retina, 10 layers of the retina. The outer layer, the water balloon that holds the eye, called the sclera. The very next layer in is the choroid. This is arteries that look like a roller coaster. The arteries go up and down, and they connect directly to a vein. This is unheard of. All the rest of the organs and tissues have capillary beds, like spider webs through the tissue, not the eye. And at the top of these roller coasters are little holes. These holes are very small. The oxygen can get through, the nutrients can get through, but the blood cells keep on going. Now, the Chinese have an axiom that the eyes open from the liver. Well, what's the connection from the liver to the eyes? If you listen to my previous one about the liver, you got a pretty good idea. The thing is, if your liver congests or you're on too many drugs or whatever, more metabolic waste sneaks through the system and can clog those little holes. You clog those little holes, you're going to run into trouble. Now, I think there's a possible connection to retinitis pigmentosa, where there's a separation of the pigment layer from the choroid. It bubbles up through the other 7 layers of the retina. And the holes in the arteries may be smaller in those patients who suffer from this, and they say it's genetic. Maybe it's genetic, but I think the holes clog up. And that accounts for, I had one patient, actually it was my first patient. She had RP all her life. She had, mostly they have trouble seeing at night. As children, they don't want to go out at night because they don't have any night vision. And then she was seeing okay, she was driving, and she worked in a blood lab. And this blood lab wanted her to get a hepatitis C shot. So I gave her a hepatitis C shot, and they measured her antigen. She had no antigen. So they said, we'll give you another shot. They did this 3 times. The third one was the charm. When she did the third shot, it inflamed her liver, and the retinitis pigmentosa bloomed, and she lost her vision.
Oh my.
Now, she was legally blind for 8 years before we saw her. If you go on YouTube, you can see how we got most of her vision back.
We are going to link it under this video.
Yeah. She was really cool. She opened the door. Of course, my own experience with this, the reason I got interested in eyes is about 25 years ago, I got LASIK surgery, and they made a mistake, and I had my head frozen, and they keep on burning. And it smelled like burnt bacon, I swear. And the next day, I saw perfectly. I thought, oh my God, I can't believe this. It was beautiful. 3 years later, I get up. I took a nap on a table like that. I had an office in Miami Beach, and I just took a nap, and I got up, and I had 50 floaters in each eye and very dull vision. Turns out they fried the lens, and they fried the retina. Of course, you'll never get them to admit to that. But it took everything I had to get most of my vision back. I had to research it. In doing so, I've been able to help, other people and with their vision. And we've made discovery after discovery after discovery. We find all kinds of new stuff. I've been doing it now for almost 14 years. And so now you have this pigment layer, right? So now the next layer, excuse me, that was the vascular layer with the roller coaster arteries. The next layer is a sponge-like. It's called the pigment layer. And by diffusion, the nutrients and oxygen diffuse into the sponge called the pigment layer. The rods and cones stick in the pigment layer like your teeth are in your gums. Like your teeth have little arteries and veins in them. No, not these guys. These guys get their nutrients by diffusion. It seeps in. The higher the concentration in the pigment layer, the better these guys, the happier they are. All right? And they get it from the choroid, the vascular layer. Your rods and cones are like your teeth are in your gums, and this is how they get their nutrition. So you can see if you plug up those arteries, you're going to get some spots. Some plug up, some don't. And you get some tears in the retina. Starts to peel off. You start seeing floaters because little pieces around it aren't getting nourished. And something that we need to go back a little bit. Remember this fluid that's nourished by the cornea, the aqueous humor gets nourished, and it nourishes the vitreous humor. Then it gets to the macular cells. Then the macular cells transport it into all 10 layers of the retina. They're like little posts that give the integrity to the retina, 10 layers. It's like the pillars. They give it dimension, right? These pillars diffuse the nutrients from the aqueous humor. These nutrients also not only feed, the retina, but these things they're called microglial cells. They're cells, macrophages, astrocytes that all come in, swim around in this fluid to repair, to assist in seeing.